Hello, everybody. Welcome to another edition of Community Works. I'm Bernadette Welsh, your host. Each one of our shows highlights a local agency in our community, a charitable agency. Our goal is to educate you, our viewers, about the great work that's going on all around us every day by local agencies and their supporters. When people help their neighbors, everybody benefits. The focus of today's show is suicide prevention. It's a serious topic that I think we all need to learn more about. And I'm very fortunate to have two members of the Board of Directors for the American Foundation for Suicide Prevention on the show with me today. So I'd like to introduce them to you. Paul Daigle is the co-founder and vice president of the Brian Nagel Foundation, and he is also the chairperson for the American Foundation for Suicide Prevention. Thank you, Paul, for being on the show.
Thank you, Bernadette.
And joining Paul is Anne Romano, and she is a director of library services and a coordinator for continuing medical education at the Silver Hill Hospital. And she also happens to be the secretary of the Board of Directors. So welcome to the show, Anne.
Thank you, Bernadette.
Oh, that's wonderful. Okay, Paul, I'm going to start with you as I usually do to get our viewers to understand what does the American Foundation for Suicide Prevention, what's its mission, a little bit of the history if you don't mind.
The mission is pretty simple. It's to save lives and to bring hope to those people who are affected by suicide, whether they're suicide attempt survivors or whether they're suicide folks who have lost someone to suicide, lost survivor. Because people who are struggling lose hope. People who lose someone to suicide have a hard time finding hope again. So that's the mission, is to prevent the suicide, or where we can bring hope to people who are struggling with their mental health, or bring hope to folks who have lost someone to suicide.
And has the Connecticut chapter been around for very long?
The Connecticut chapter has been along for quite some time. AFSP was started in 1987 by a group of families who had all lost a loved one. And they wanted to get together to try and bring a private organization to look at research and education on suicide prevention. The Connecticut chapter, I'm not sure exactly how long it's been here, but I was one of the founding members for the Northern Connecticut chapter back in 2016. And in 2018, we joined the two chapters together, the Southern chapter and the Northern chapter. So now we have one chapter here in Connecticut. And we have a board of directors of 9 personnel. Michelle Peters, our area director, is the only paid staff member of our local chapter. And the rest of the organization is 100% volunteering. Not only the board members, but people that come out and support our events. They're all volunteers. They provide training to companies, schools, and it's a 99% run volunteer organization.
Well, we're going to get back to how important those volunteers are in a little bit. But thank you, Paul, letting our folks know what we're talking about today. And would you elaborate a little bit now for what the programs and services are for the American Foundation for Suicide Prevention?
Sure. I want to begin by what Paul alluded to, the fact that we are based on research. We are the largest not-for-profit research-based organization that deals with suicide. Advocacy, we do a lot with both local and national advocacy work, public policy, education, which I'm going to get to, and then supporting those who have been impacted by suicide. So our educational programs, there's many different programs for different populations. There's Talk Saves Lives, which can be adapted to various populations. So if it's for the workplace, if it's for a college community, if it's for a parent organization, if it's for corrections officers, for those who have firearms. So just about every program that we have can be adapted to different populations, faith-based organizations, and they can be in person or they can be done by Zoom, so they can be done remotely.
Okay, so there are people that get together to support each other if they have lost a loved one. There are other groups of people that function in the organization depending on what they
we could provide trainers to have an actual education program. We also have support groups to support those who have been impacted by suicide.
Yeah, I noticed that was on the website. So thank you very much. Okay, Paul, this is a very important part of the program tonight. Could you please tell us about the Brian Daigle Foundation and your own personal story, which I give you so many blessings for being willing to share that with our viewers.
Well, thank you. We lost Brian in 2011, 12/11. Had no idea he was struggling, had no concerns for his well-being, and it was a shock. Less than a year later, two of his high school friends were students at the University of Connecticut, and they formed a team for an Out of the Darkness walk, which you'll hear about later on. My wife and I went to that walk not knowing if we could do it, not knowing if we could finish it, but we did. And that was our first exposure to the American Foundation for Suicide Prevention. And it let us know we were not alone as lost survivors. We also became involved with AFSP, as I stated earlier. We started the Northern chapter. But my wife, Ann, had a hard time finding someone to help her understand and try to figure how she could live her life with any sense of hope or enjoyment or happiness again after losing our son. She had to go out of state to find a support group up in Massachusetts. She traveled up there twice a month for a year and a half to be able to find people, other people who had lost someone, and that really helped her. And as she started to heal, started to get stronger in her understanding of what happened and what was going to go on with the rest of our lives, she said we needed something like this in Connecticut. So we formed the Brian Daigle Foundation in 2014. Our mission is to provide both grief support services for all losses, not just suicide losses, and also mental health and suicide education. We opened a Hope and Healing Center in Niantic, Connecticut, where we run support groups there, and we run various mental health and suicide awareness training programs throughout the state.
So that's an actual location.
We have a physical building.
Go to?
Yep, and we have people that we're in the quiet southeast corner, but we have people who come from up from this area. We have people who come from Manchester. Even some people from Rhode Island come, and it's just to let people know they have a place to go. We're not therapists.
Right.
We're peer support people. We don't give them advice. We share what we did, what we tried, what worked for us, what didn't work for us. And the most important thing we do for someone who's grieving is to try and let them know, don't give up hope. Someday, with hard work, it won't take care of it by itself. You will be able to learn how to live your life after the loss. And sometimes at the beginning, you're not sure how you can survive a loss.
I certainly can relate to that, Paul. I mean, my own son has a mental illness. We lost a cousin to suicide recently, and you think, and I remember going to the memorial service, and we were chatting, and somebody smiled and laughed, and his sister said, "How could you laugh?" And we just were like, "Oh, we're sorry." But you can laugh again.
It takes time.
It takes time. It was just too raw.
Right.
It was too raw. That how could you laugh? Yeah. So thank you. Just being able to talk about it. You know, some people really don't want to talk about it because it just makes them feel bad. But actually, it winds up making you feel better, doesn't it?
You learn you're not alone, and one of the things we tell the folks in our support group is you have to feel your grief to heal it. You can't suppress it. You can't ignore it, because it's never going to leave. You're going to grieve the person you love for the rest of your life.
Yes.
And if you put the work in, there'll be a way that you will learn to live your life with that loss. But it's not going to be done in a week. It's not going to be done in a year. It could take a long time. There's no set schedule. Every person grieves differently. Every person heals differently.
That's very important. Thank you, Paul. That was really very important. Okay, Ann, we're back to you. You have a very important role at the Silver Hill Hospital and your involvement with the American Foundation for Suicide Prevention. So you could tell our viewers a little bit about that?
Sure. Silver Hill Hospital is a not-for-profit psychiatric hospital located in New Canaan, Connecticut. We serve patients, adolescents, so 13 on up. And our mission really aligns with the mission of AFSP. We are there to transform the lives of people that have been impacted by mental illness and addiction. So when AFSP Connecticut decided to have a Fairfield County Walkathon. Silver Hill Hospital became one of the big sponsors, and they've been a sponsor every year. I've been a team captain where I recruit my coworkers to walk, to fundraise, and then from there I was asked to attend some of the board meetings. I went to something called the Chapter Leadership Conference, which is a national conference which just took place, and that's for all 50 chapters, 50 states, which has also Puerto Rico and DC. And then I was asked to join the board, and I have co-chaired the walk that has happened in Fairfield County for the past 3 years in Westport. But my role as the coordinator of continuing medical education is that we as an organization, as a hospital, we want to give back to the community and we want to educate people. So we have brought in one of the top researchers from AFSP, Dr. Jill, to come and give a grand rounds lecture about new innovations about research in suicide prevention. And then this year and next year we're going to have a focus on loneliness, which we know with loneliness and lack of socialization, isolation. These are hot topics that even the U.S. Surgeon General and Senator Chris Murphy has brought to the forefront. We want to be able to provide community lectures as well as lectures for clinicians.
That is so important. Again, we don't understand why somebody might be isolating. Why are they not coming to family events? Why are they missing out? And then we say, oh, well, we don't want to interfere. We don't want to be pushy. But I think you've got me this little thing that says, talk saves lives. Talk saves lives. So, to reach out from that loneliness to say, hey, I just want to stop by and say hello.
Right.
If he says, don't come over, come over anyway. Come on, I'll bring cookies.
Right.
So that is also very important to break that loneliness, because then the family member says, but I didn't know. So because it's the communication that we need to do. So that's a wonderful program, and I hope our viewers will reach out for that and take advantage of that if they need to take advantage of that. Okay, so thank you. Okay, Paul, this is really one of the most important parts of our program, because now I'd love for you to talk to our folks about causes of suicide, what they can learn about the warning signs or what people are going through. So, Paul, if you'd be so kind.
Well, the first thing I'd like to say is it is very, very seldom, if at all, a single cause for someone taking their own life.
Okay.
It's usually a combination of many factors that can bring a person to lose hope, total hope, and to make a decision to take their lives because they don't think there's any other way to end their pain, whether their pain is mental, health-wise, or whether it's a physical pain. So the risk factors can be put into 3 categories: health, environmental, and historical. From a health standpoint, someone could be struggling with severe depression, anxiety, bipolar, a mental health condition. Or it could be a physical health, a severe pain. Someone had an accident. Someone has a disease that they're in pain every day, all day, and they decide they can't live with that pain any longer. So they turn to suicide to relieve their pain, both either mentally or physically. Environmental factors could be a significant life event, a divorce, a financial crisis. It could be someone who is being harassed or bullied. There's just too much stress in their lives. Or it could be some type of trauma that just gets them off kilter. Historical factors can be they've attempted previously. Someone in their family has died by suicide. Or it can be a result of, as I stated earlier, trauma. They could have been as a child, they could have been molested. They could have saw a traumatic event that they never were able to fully understand and comprehend or get help to understand and comprehend.
Yeah, they didn't get the help.
Right. So there's many, many factors that could compile or result in someone feeling that there's no other option but to end their lives. So what do you do?
Yeah, what
do you do about it? So what are the warning signs?
Yes.
So now you get into the warning signs, and they can be broken down into 3 categories as well. How an individual is speaking, how they're behaving, and what moods they may be displaying. So, very simple. Talking. I want to kill myself. If someone states that, it can't be brushed off. Say, don't, you're not going to kill yourself, and don't ignore that. Right. That is a clear-cut sign. I don't have anything to live for. And those type statements that could be someone's just having a bad day, or someone's really struggling with their understanding about how they're going to, live with whatever discomfort they have, whether it's mental or physical. From a behavioral standpoint, they change, they isolate, they withdraw from normal activities. Eating changes, they're not eating correctly. Right. They may be sleeping excessively or not sleeping enough. They may be self-medicating more with alcohol or drugs.
Right.
Those are type behaviors that are telltale signs someone is struggling. You don't know what they may be struggling with, but they're struggling. They're not healthy behaviors. And when you see an unhealthy behavior, that's when you need to take some action. The third category is their mood. Are they struggling with depression? They'll tell you they're depressed, or they've been treated for depression and it's not working. Are they irritable? They have very short tempers over indiscriminate items that aren't that important. So when you look at all those factors, what would you do? The most important thing is to start the conversation. Mm-hmm. And it doesn't matter what level of experience you do or don't have. Letting the person know you care is the most important thing when you think someone is struggling. You can't, as lay people, we can't go provide therapy or provide medication for someone.
We can't force people to get help either. If they say, "How are you?" and they say, "I'm fine, I'm fine. What are you nagging me for? What are you ragging on me for?"
And when someone does reject your offer of help or your concern, the next best thing to do then is to follow up. Not in that one conversation, might be the next day.
Okay.
Right? When they continue to display these warning signs, it is important to repeat your concern for them and your care for them, and recommend that they go get some type of help. In the worst case scenario, if they are not listening or taking your advice to get help, and you really think they're at the point where they are going to do something drastic and take their lives by suicide, then you have to reach out for professional help. Mm-hmm. Right? You can persuade them for help, you can refer them to help, and then you can call to get help for them because they're in crisis and you're not sure they're going to, be with us tomorrow.
We were talking before the show, Paul, about how some suicides may not be preventable, and I don't want to belabor it, but is there something that you could share with our viewers about that?
I'm not a professional.
Right.
My experiences.
You can jump into if you like.
But I think my view on mental health and the treatment you get for mental health, it's very important. Without it, the risk of suicide is so high. With it, it can prevent suicide, but sometimes it's not enough.
Right.
Right. No matter how much help, whether someone is seeing a physician, a psychiatrist, or a therapist, whether they're on medication, whether they've gone into a facility for treatment, we know that people have received a lot of help to understand their mental health conditions, to learn how to recognize it when it's driving them into a deep, dark place, and then develop the coping skills that they can take some action so they don't continue to go into that dark hole. But there are cases where we've experienced people who have lost a loved one who have done everything possibly they could do, and they still lost their loved one. So Ann might be able to say it better than I. I look at it as cancer. Some cancers can be cured.
Right.
All cancers can't be cured.
Right.
So, but that doesn't mean we stop trying.
There you go. We certainly want to keep trying. But thank you, Paul, because again, there's so much guilt in families that have lost a loved one, and they say, "Why didn't I know? Why didn't I do this? Why? And then it can really destroy a family and
as
make it
Paul
so sad.
mentioned, reaching out for help. That's when 988 comes into play.
Ah, yes, let's talk about 988.
That, you know, we have 911 for medical emergencies. Now we have a 3-digit number to call the crisis intervention line. You can call or text, or you can text TALK to 741-741. But I do a lot of tabling events at colleges, and I ask the college students, do you all know what 911 is? And they say yes. And I said, do you know what 988 is? And a lot of them don't know about 988. But there used to be another number to call, the suicide hotline, but it's simple now. Every state has it.
Okay,
and that
so
was
it's every state.
something that, you know, again, for public policy, that was something that they really pushed for. And so now it's simple. I ask everyone to put it in their phones, put it in their contacts. And it's not necessarily for the person in crisis, but if you're concerned about somebody, you can call as well.
Okay, so it's for all of us.
Right.
It's all of us. Because we were talking about 211 being one where you might be homeless or having a mental health crisis, but 988 is specifically for issues dealing with suicide,
Right.
feelings of suicide, or knowing that someone might be in crisis,
Right.
or knowing that somebody just isn't acting the way they've been acting before. There's just, or you feel that just something is amiss.
Right.
And it's always good to get information. So what if you're wrong? You know, so what? You still reached out.
Yeah.
Better.
It's
It's better.
best to be
it's
wrong.
better. It's better. Much better, for sure. Okay. Ann, in the spring and fall here in Connecticut, there are walks. And I know you're an expert on about this topic. So would you please tell our viewers about the walks and what they do for the American Foundation for Suicide Prevention?
Sure. So last year we had campus walks. We had one at Mitchell College, we had Fairfield University, and we had Darien High School have a walk. In the Darien High School walk, there were over 500 students and parents that attended, and they raised, I think, $34,000. They were in the top 10 campus walks nationwide, and we received a plaque for that at the CLC conference. And then we have community walks, and in the state of Connecticut we have 5, and it was Niantic, Hamden, New Haven, we had Fairfield County, we had Hartford, and we had Litchfield. And the Fairfield County walk raised over $100,000, so we received a plaque at the national conference that just took place. And the money stays local, and it funds our, you know, when you have a trainer come in to give a presentation, you're not charged anything, you know, it's all free. Any materials we supply, that is all free. So again, it's for research, it's for advocacy, it's for education, and supporting those impacted.
And we will have these beads on. Don't
And I
we all
wanted
have
to
these
mention
beads
that
on?
if you go to one of the walks, you will
Okay.
notice that there are 10 different colors, and you'll see people walking around basically telling their story,
By
their
the colors.
connection
So
to the
colors,
cause.
the colors mean something.
Right,
Is
so
that
you
it?
have purple.
Yes, I have purple on this hand.
Right, and that is if you've lost a friend or relative.
Right.
Paul has white, the loss of a child.
Yes.
I have teal because I support people who struggle, and that is, you know, patients and
Yes.
family members who struggle. And then blue is for supporting the cause of suicide prevention. There's other colors as well, but as you walk around the walks, you'll see people wearing the different color beads, and it's telling their story, and it's a way that we can connect to one another.
And also to show the respect and sensitivity that we would want to show to somebody who's wearing white beads,
Right.
or the purple beads, because again, sometimes we don't know what to say, or we don't know how to say things. But when you realize that somebody is in this condition, and maybe you might just say, hello, Paul, Ann, how are you today?
Right.
And you say, well, we're here.
Yeah,
You
and
know,
just
sometimes that's all you could say.
sorry for your loss, but I'm glad you're here.
Yeah, we're sorry
supporting
for your loss.
Everyone who's here. And that's what we do at the walks. We support one another. And that's what we got from our first walk. We had 30, 40 relatives and family members, but there were another 200-300 people that were there. And we were the walks, you support one another, and you let everyone know you're not alone.
Yes, you're not
And that's
alone.
so important.
I think so. That's just wonderful. So the next walks will be, there's something planned for the fall, Ann?
We already have the Fairfield University walk on our website, so you can visit the website to see all of our events, including the walks. We haven't firmed up the dates for the community walks yet. There's also an overnight walk that's a national walk taking place in Boston, June 22nd. That's about a 16-mile walk, and there'll be a team from Connecticut participating in that.
Great.
And that's the true out of the darkness walk. You start walking around 7 or 8 o'clock at night, and you come out of the darkness in the morning.
Wow. No, really? Really?
It's very powerful.
It's at night?
Yes.
People have flashlights?
There's volunteers across the route. It's 16 miles long. It's a very powerful event for people who have lost a loved one or who support the cause of helping others come out of the darkness and get the help they need to be able to enjoy life again.
Wow, I didn't realize it was through the night.
Yeah.
Well, thank you. See that? If you have trouble sleeping, don't worry about it. You go on the walk and you'll sleep later. So it's okay. It's okay. Okay, so now let's talk about money. We have to talk about money and what the American Foundation for Suicide Prevention needs. I know we need money and volunteers and that. So, Paul, how do you raise the money?
The majority of the money that's raised comes from individuals. People who have lost a loved one, people who have lost a friend, people who struggle themselves and want to help other people. We raise money to help other people, to save lives, and to support those affected by suicide. Many different events that we run. The Out of the Darkness walks we just talked about, the 5 of. The campus walks. We usually run 3 to 4, sometimes 5 campus walks in the state of Connecticut. There's also smaller fundraising events. Hike for Hope, Pause for Prevention, where people get together, they bring their dogs.
Oh,
and it's like a dog pause.
PAWS,
right.
okay.
Right. So, and then there's do-it-yourself fundraisers. A restaurant will run a meal, a dine out, where they'll donate a percentage of it. Some people will run bake sales. It's a grassroots effort to raise the money, and the money will come into the chapter. Half of the money will stay here in Connecticut, half goes to national to support all the research. And AFSP does multi-million dollars of research grants every single year.
Okay.
And they're trying to get a better understanding of how the most complicated organ in our body functions, and that's our brain.
That's the mind.
Right? And so as Ann stated earlier, all of our training, all of our things, it's all science-based. It's not just feel-good training. It's all based on what we have.
I'm afraid we're running out of time, and I just wanted to present these checks from our family to the American Foundation for you there, Paul. And I know there's a lot of information on the website. I'm going to direct people for the website. We're going to see a screen in a second where they can see where they can go for all this wonderful information that we've been talking about. I know, Paul, you need volunteers, and I know we're running out of time. We want people to know the American Foundation needs volunteers. Only the director, Michelle Peters, God bless her, she's paid. Everybody else is volunteer. So be a volunteer. It'll do you some good. So please go to the website. It's going to come up on the screen, and go there. There's so much information. How to find a support group, how to learn the risk signs for it, what's going on in Connecticut, what's going on in other states in our country. There's so much that you can learn. So thank you very much for watching our program today. I hope you've learned a lot. I have. And I'd like to dedicate this show to our cousin, David Anthony Rubio, who lost his life to suicide, Paul's son, so many other people who have dealt with this situation. Again, thank you for watching. I'm Bernadette Welsh for Community Works. Thank you, Paul. Thank you, Ann. And thank you, Michelle. We'll see you again soon.